Hey guys, it's Jessica Ward King, the StigmaCrusher here. Today I wanted to talk about medications and specifically going on and off of medications. So psychiatric medications, most of them are not the type that you can just go in at full strength. Most of the psychiatric medications, and in fact, all of the ones I've taken, you have to start out at a low dose and then what they call titrate up. So that means start out at a low dose and then go up to another dose, maybe double it, and then go up to another dose and then go up to another dose until you finally end up either at a dose that works for you or at the recommended therapeutic threshold. And so it takes a long time, quite often, and it depends on how sensitive you are. I mean, all of these things are going to depend on the person, depend on your biochemistry, depend on your needs, depend on your illness. But in general, it takes, you would be on one dose of the medication for 1, maybe 2 weeks, and then go up to the next dose of the medication for another 1 to 2 weeks, and then go up to the next dose. And it can take you over 2 months to get to a recommended therapeutic level for any given medication, sometimes longer, sometimes shorter, but sometimes longer. This is a very frustrating process, but it is necessary for a bunch of reasons. One of them is that our recommendations for a therapeutic level are only that. They're only recommendations. And so while for one person, let's say 20 milligrams of Prozac will work, for another person, it's more like 80 or 120 that's going to work. And so by going up slowly, you will end up taking the least amount of medication that you need in order to control your illness. And that's always a good thing because nobody wants to be a walking pharmacy, because the higher the dose, the more expensive the medication is. And of course, you don't want excess medication in there because with side effects and all the other stuff they can do to your body, you really don't want to be taking too much medication. So that's one of the reasons that titrating up is a good idea. Another of the reasons, though, and the one I think that that seems to affect most people, is that a lot of these medications are very strong and they have a lot of side effects. The side effect profile of most antidepressant medications isn't particularly favorable. Now, for a lot of people, they will be very tolerable side effects, and those side effects that do manifest themselves can be reduced greatly by using the titrating method. So things like tiredness, which is a side effect for a lot of medication, headache, stomach ache or upset stomach in general, upset, digestive system, other things that are more common, such as body aches or feeling a little spaced out. Those kinds of things can really be reduced by starting on a low dose, letting your body and brain get used to that low dose, and then increasing it. And so while you may have a long period where, every 2 weeks your side effect profile kind of bumps up again, you end up with a side effects, and it tapers off, and then side effects, and then it levels off, and then side effects, and so on. And those side effects will be less severe than if you just jumped right to a high but therapeutic dose of the medication. Another of the reasons is that we want to try to control some of the more serious side effects. So some of the side effects of these medications are not at all trivial. And things like with SSRIs, for example, so things like Prozac, and especially in young people or the elderly, thoughts of suicide or suicidal ideations can occur. Obviously, we would want to try to minimize the risk of something like that. For antipsychotics, for example, tardive dyskinesia or extrapyramidal side effects can occur. And those would be movement disorders. Sometimes they are irreversible. So you don't want that to occur. With something like lithium, you can actually get toxic in the amount of lithium that's in your body. And with severe lithium toxicity, you can end up dying. So that's obviously not something we want to happen. So we try to titrate up so that we can monitor the side effects. In the case of something like Epival or lithium, you can actually monitor the amount of the medication in your bloodstream by doing regular blood tests and make sure that you get to a therapeutic level, but not too much. So that's another reason to titrate. And so that's titrating up. Now, the really frustrating thing is that once you get up to either if you get up to a level where the medication is helping you, it's working for you, you can stay at that level for quite some time. Sometimes that's all you need, and then you can eventually get off it. But if it doesn't work for you, you can't just stop taking it. You should never just stop taking any psychiatric medication, because you can get some very unpleasant side effects if you stop abruptly as well. So your body gets used to the chemicals that are floating around inside of it. Your brain gets used to those chemicals. And when you suddenly stop, the body and the brain are like, hey, that chemical I was getting is no longer here, and you can get side effects. One of the most common ones that we've heard about in recent years is what they call brain zaps that you can get when you're going off of an SSRI, like Prozac or like citalopram or something like that. And so it kind of feels like a jolt, like of kind of weird feeling inside your body. People don't like it. It's not, as far as we can tell, dangerous, but people don't like it. And that's something that is more likely to happen if you stop what they call cold turkey. And the thing that's really frustrating about this is that not only can you not just stop immediately, but you have to taper down just like you tapered up. Sometimes it's a bit faster, but sometimes not. And so you end up having to taper down sometimes even before you can start tapering up on a different medication. And I've addressed this in other videos before. Quite often, the medication that a clinician will use is in the same class or a very closely related class to the one you're already taking. So subbing out Prozac or fluoxetine for citalopram, for example, both are SSRIs, and you can't really be having too much of both chemicals in your body at once. So you have to taper down on the Prozac before you can kind of taper up on the citalopram. And so it can get really frustrating because you end up as a patient with the message that there's going to be quite a long period of time while you're tapering up and tapering down and tapering back up that you won't have enough medication on board to actually effectively treat your illness. So imagine if you were in pain and you go to the emergency room because you're in excruciating pain, and they said, well, we can't give you the full dose of, let's say, Tylenol or something stronger, let's say Dilaudid. We have to taper you up. And so for the first hour, we can only give you like half of a pill. And then 4 hours later, we can give you a whole pill. And then 4 hours after that, we can give you 1.5. And then 4 hours after that, we can give you 2. And that's your actual dose that's going to help take care of your pain. Well, that's like, what? How many did I say? 12 or 16 hours later that you would actually have control for your pain. You wouldn't accept that. That seems ridiculous. But that is the case with psychiatric medications, because you do have to be more careful with these and with the side effects that they can cause. Something that always gets asked of me when I talk about this titration up and titration down business is, okay, so if I have to titrate down and I'm going to have these bad effects when I go off of a medication, does that mean I'm addicted to it or dependent on it? And there's a big difference between your body being used to having a medicine in it, and then when that medicine is missing, there being side effects, and you being psychologically or physiologically dependent on that medication or on that drug in order to function. So it's not always pleasant going off of psychiatric medications, but when we talk about addiction or drug dependence, that means that there has to be a psychological craving for the drug. You have to be preoccupied with where you're going to get your next fix, as they say, or where you're going to get your next dosage. You have to have thoughts about, like anxiety with what would happen if you couldn't get your next dosage. The withdrawal effects from a medication addiction or a drug are quite different from the side effects that you get when you are withdrawing from a drug. And I can see where the confusion is, because I'm using this word withdraw and I'm saying withdraw from a drug or withdrawal from a drug, and what's the difference? Really what it is that it's not your body craving that medication or that drug, and as soon as it gets it, it will calm down and be better, as it is with addiction or dependence. It's really just a matter of that medication is missing, and so your body is having to either produce more of something else, or really just feeling the effect, the lack of it. And so you can get addicted to some psychiatric medications, the most notable one being anxiolytics, or things like Valium, diazepam, or that whole class of drugs. Basically, you can get addicted to those medications, and you get the full effects of, like, the physiological effects of craving the drug, but also the psychological effects of that you can't function without it. Where are you going to get your next pill if you were to run out, or if there was, there's drug shortages all around North America these days. What if there was a shortage of that medication? What would you do? And you have anxiety over that. More than just, my illness wouldn't be treated, but rather, what would I do without it? I couldn't function. And so that's really what we use to kind of define and what the hallmark is of addiction. And so, can people be addicted to fluoxetine, Prozac, or can they be addicted to antipsychotics or to lithium? No, there's not really any addiction potential for those medications. They don't cause a high. They don't cause a pleasurable high. When you withdraw from them, or when you stop taking them, they can cause side effects, but they don't cause physical cravings. And so, no, it's not addiction. I can liken it to, okay, this is one I have. I have used lip balm for as long as I can remember. Started when I was a kid, and my lips got super chapped and they were bleeding and cracking, and my parents said, try lip balm, use Vaseline on your lips. And I started, and I never looked back. I like the feeling of it on my lips. I like the way that it moisturizes my lips. And if I don't have any, my lips will get dry for a period. Now, if I went for a decent amount of time without any Vaseline or lip balm, my lips would learn to produce, their natural amount of moisture, and I would not need it anymore, I'm sure. But I don't have like a craving for it. I don't worry what will happen if I don't have any lip balm. And so we wouldn't call that an addiction. We would simply call that, like, that effect that I would get if I stopped using it, where they would get initially dry and cracked. That's just a side effect of stopping using that active ingredient. So it's not exactly the same thing, but it's similar to that. So you can imagine different products that you use, that you enjoy using, and that you wouldn't be happy to have the effects from not using, but you would get used to it. Similar with most psychiatric medications. So that's kind of the story with the tapering up, the tapering down. Remember that if you are on that journey of tapering up and tapering down, first of all, don't get discouraged. It usually takes a couple of tries to find the medication that's going to work with your body, with your brain chemistry. And that's why we have so many different medications. For example, SSRIs are a whole class of antidepressants. And they're all fairly related, chemical structure speaking. And that's how they get developed, right? Someone develops a medication, finds that it works, it helps to relieve depression in a certain amount of the population, and develops their medication, which happened with Prozac. And then a bunch of other drug companies jump on the bandwagon, analyze the molecule, change one thing, one atom or a bond here or there, and then call it a new medication. And it works differently in different bodies for different people. So until we have the blood test or the scan that identifies maybe what type of mental illness you have, what type of depression you have, for example, what subtype, or what medication is going to work best for you, until we have those tests or that knowledge, it's going to be trial and error to find the one that works with your brain chemistry, because we simply don't know enough right now about how the brain works and how these medications work in order to be able to predict. Psychiatrists are best placed to be able to do this prediction because they've seen a lot of patients that have these different symptoms, different disorders. They have seen, like, their clinical insight is that patients with certain types of symptoms, for example, in depression, anhedonia, might respond to certain types of medications more often in their clinical opinion. But quite often, a lot of folks that are just starting out their journey with mental illness, or that have a quote unquote milder form of mental illness, will be seeing their general practitioner, who maybe doesn't have that knowledge, that clinical experience. And so they may start out with a shot in the dark. They may start out with, well, what side effects do you most not want to see? And go for a medication with that side effect profile. And then you find it doesn't work for you and you have to change to another one. And it is trial and error. So don't get discouraged. Don't try to rush the process by saying, well, to heck with that. I'm going to start taking, I'm not going to take one for 2 weeks and then go up to taking 2. I'm just going to take 2 right away. Don't do it, because I promise you the side effects are not worth it. And your doctor has this prescription schedule for you because for good reasons. They want to see what's going to work. They want the least amount of drug in your system that you need. Because if you're going to be on this for a long period of time, you don't want to be taking extra, right? And they want to try to minimize the amount of side effects, because one of the main things that happens is that if people experience too many side effects or bad enough side effects, they just won't come back, or they'll stop taking their medication altogether. And that can be very dangerous. That can lead to the worsening of the mental illness. That can lead to thoughts of suicide because things aren't getting better, and people feel like there's no hope for it to get better. So that's not a desirable outcome. And so your doctor has prescribed this medication in this particular schedule to benefit you. So don't go ahead of yourself. Also, don't just stop them right away, as I've discussed, just to get off it quicker so you can start a new one. Because again, your doctor is having you come down in a safe way, and in a way that is the best for you. If you don't feel like this dosing schedule is going to work for you, I urge you to talk to your doctor. So if they say, start out small, take this for 2 weeks and then go up, and you say, Doc, I can't do this anymore. I can't wait this long. Is it possible for us to do this faster? It may be possible. And your doctor may say, well, yes, but the side effects may be worse, and here's what you would need to be looking for. So talk to your doctor. Don't just be a passive patient. That's one of the big problems with the psychiatric model right now, is that we feel like we just have to take whatever they tell us. And then we go home and say, well, I'm not doing that. And that doesn't benefit anybody. Medication compliance is really important with psychiatric disorders. So definitely don't just stop on your own. Don't do anything that your healthcare provider hasn't already told you in the advice when they when they give you your prescription. So that's all I wanted to reflect on today. Let me know, what's your experience with going up on medications, going down on medications, trying to find the right medication and the right cocktail of medications? Do you find it frustrating? Do you have any experiences or any caveats or anything to let us all know about? Please let us know in the comments below. That's the best way to learn, is for us to share our experiences. So take care, have a great week, and I'll see you in my next one. Bye.
StigmaCrusher.